My name is Holly Stander, and I have multiple sclerosis. Sometimes, when you're sick, you need somebody more than taking your blood pressure and taking a little prick of and sending you home. You need somebody who's going to listen to you. You need somebody to know what's going on in your brain and in your heart.
All across this country, people who have mental health problems, psychological symptoms, substance use problems, are suffering for lack of care. They can't get care. The waiting list for mental health services are long, and the care that you get, the care that one gets, is often fragmented and incomplete. Here at the University of Colorado, particularly in the Department of Family Medicine, we have been working for 20 years on integrating behavioral health into primary care and transforming the basic workflow of primary care.
I'm Amy English. I'm the medical director and a family doc here at A.F. Williams, which is CU's flagship family medicine practice. We've been practicing an integrated care model really for about 3 decades.
When we speak of integrated care, we could mean one of two things. In the first place, we create for each patient in the primary care setting an integrated, comprehensive personal care plan. For example, if you come to see me as a patient and you have problems with diabetes and arthritis and depression, we'll put together for you, the clinician team will put together for you a plan for your health. So integration means an integrated personal care plan for each individual patient. It also means we integrate the expertise of, for example, family physicians or family nurse practitioners or general internists or pediatricians with behavioral clinicians, psychologists, social workers, psychiatrists. We integrate their expertise into a coherent team that collectively converges on this personal care plan that's integrated.
We're on the front lines of access just because people can get into primary care, but we're also available because we've broken down barriers of trust and create access by being able to be approachable.
I was hit by a car. It wasn't the first time. I'd been hit 2 other times before, but this 3rd time I was really hurt. I just felt completely worthless. I had absolutely no value or anything. Fortunately, I was working with Chandra and the people here already, so when I came in and they're telling them all about this, it was very, very important that they listen to me, that they care. What can we do? How can we help? And I needed that. I really did.
It takes a whole team of experts with a variety of different skill sets. And so sometimes that's the primary care doc. Sometimes it's someone like myself who's a behavioral health provider. Sometimes it's our pharmacist or our social worker, our care manager. Sometimes it's our front desk, our medical assistants who know that patient best and connect with that patient best. So we're always looking to determine what are the needs, how are they presenting now, and then what can we do as a team to make sure that we're delivering the best care when it's presenting, where it's presenting.
The telemedicine, the video conferencing is really a component of the larger integrated care.
Hey Lynn, I'm Dan Burke. I'm one of the
As a patient may need additional psychiatric consults to clarify diagnosis, to get recommendations around medications, the psychiatrist then gets involved.
Generally, with somebody with pretty bad anxiety.
I think that if other practices can see what we do and learn from it and maybe adopt part of what we do, that we could really do a better job of increasing access and improving lives for populations of folks that really need it.
As of today, there are about 300 primary care practices in the state of Colorado that practice integrated behavioral primary health care.
Being able to find the infrastructure and the ways to actually allow 4 clinicians to sit in a room with a patient in their time of need, their time of trial. That is something that only can happen when there's a team care approach, when you're able to communicate clinician to clinician and actually come up with the patient what's best for them.
For a while, I was so down, I was so depressed. But then gradually, it kind of like, it wasn't my fault that I got hit. And I had to realize that. And I am a good person. And it's been better. It's been better since I've been working with them. I can't imagine my life without them.